Yakima Valley Community College Radiologic Sciences Program presents Radiographic Positioning. Forearm.
Hi, our lesson today is a forearm. We have our patient, Drea. She's in the room. I have my supplies out, an 11 by 14 cassette, markers, lead blockers, and I think we can start. Again, a lot of the preliminary work we've talked about in previous sessions, so let's just get right down to it. I'm going to protect my patient's reproductive organs. I'm going to have my distance set at 40 to the tabletop. I'm going to be dividing my cassette in half, and these projections, an AP and a lateral, will be done on 11 by 14 lengthwise. Before I can actually decide where I'm going to put my ID blocker, I need to talk to my patient. Drea, where'd you hurt yourself? Where's your most pain? And if you notice, she's touching closer to her elbow. That would be defined as a proximal forearm. The emphasis will be placed on the elbow rather than the carpals. We're going to include both joints, but the proximal end is going to be more important. Keeping that in mind, this is how my relationship of the forearm will be. ID blocker will be towards the carpals. Okay, and you can see that? Okay. If she told me that the injury, or I could see the bleeding, the swelling, the bruising, I wouldn't have to ask the patient, but if I saw it down here, what do you suppose would be the focus? The carpals will be the focus. If the carpals are the focus, we reverse the cassette, and the ID blocker will be towards the elbow, keeping the carpal bones free of any obstacle that they might run into. Okay? So let's start with a distal forearm today. And it's a right arm. And when my patient's arm is bent, like that, I have to vision the humerus coming off, and I'm going to put my lateral on this side so the humerus will come off. That means the AP would be on this side. And my habit has been to perform my APs first. So I will continue with that habit. Why am I doing APs? If you recall from your reading, as you roll the forearm, the radius and the ulna, they'll actually cross over. In a PA position, the bones have crossed over one another. So we don't take a PA projection, we do an AP. That way the radius and the ulna will stay free from each other. I'm going to analyze the ID blocker. We're just going to kind of lift this up here so you can see. Andrea's arm is going to come out here. I want you to look. The part film reference point is the joint of interest should be included 1 inch from film's edge. Well, in this lesson, it's going to be the carpal bone should be 1 inch from film's edge. But if I have a short forearm, you have to include both joints on any forearm. But if it's a short forearm, we're actually going to center that forearm, maybe go off of our PFR a little bit. So we're analyzing our patient's shape right now and her size. When I look at this, I see the carpal bones. There's 2 inches. I see the ID blocker more like 1 inch. So I need to move her arm down, and now I think you can see that the joint spaces are going to be equally distributed, and the relationship is the same from the ID blocker to the film's edge here. So I make the mental note that the carpal bones will be about 1.5 inches from the film's edge on this particular patient. Somebody with a longer forearm, the carpal bones are actually going to be 1 inch from the film's edge. Do not go closer than 1 inch from the film's edge. You'll take the chance of clipping pertinent anatomy. And then make sure your elbow joint is 1 inch from the ID blocker, or you could possibly clip the elbow joint, and again, that is pertinent anatomy. Our focus today, though, in this setup is the carpal bones. Get both joints on there. So I'm going to go back into a positioning relationship here. And I'm going to have her extend outward on the table because I need that humerus flat. Okay? And this is not a comfortable position to hold, So you do need to hurry in your setup. I'm getting everything lined up here, adjusting the collimation. I've divided the cassette in half. There are marks on the cassette, and you divide it in half. Remember before I analyzed her arm shape, I'm actually positioning it now, and I want her carpal bones about 1.5 inches from the film's edge. Can you lean in just a little more? There we go. Good. And the elbow joint will clear the ID blocker, and the carpal bones are 1 inch from the film's edge. And if you can look at the light, it's equal shadow on both ends, but I've opened the collimator up right to the edge of the film. Side to side, I have baby light on the sides of the strip here, and I've got a little bit of shadow on the inside of the cassette, and therefore I'm showing collimation. The hand is flat and the thumb is back. I want the carpal bones in a true AP position. And this is a left arm. I'm going to be putting the marker down on the cassette like that because we hang these fingers up. And the marker is within the collimated light. And the crosshair is coming right down the center of this arm here. There we go. Okay. And I think you can take a good look at that. Okay. There would be my AP distal forearm. ID blocker is here. Carpals are about 1.5 inch from the film's edge. The elbow joint is 1.5 from the ID blocker. Okay. If I did a good job of shooting this x-ray, I'm going to let her relax now because it's not comfortable. If I did a good job positioning this in an AP position, the distal ends of the radius and ulna will barely touch, if at all, and the proximal end of the forearm will have the radius and ulna slightly superimposed. Sometimes there's a bend to the forearm, and it's not possible to get a good AP wrist and a good AP elbow on a forearm. If, because again, a natural curve to the arm. That's where focus on the joint that's nearest the injury site and make sure that's in a true AP relationship there. Okay? We've made our exposure, and now we're going to move our lead strip. Protect the first half of our cassette. We're going to turn the cassette, and now I have my patient put their forearm out there, and I get the elbow. Let's come this way. There we go. I get the elbow at a 90-degree flexion, and I want the humerus flat, so the patient either has to scoot their chair back or they have to lean into the table. Get your patient comfortable. No knees underneath the tabletop. Okay. And again, you try to hurry. These are not comfortable positions to hold. And I'm realigning my setup here. I got it close. Now I'm going to focus on her. Here's the carpal bones. I want them the same level as my very first one. So here's my carpal bones, and if you remember, they were 1.5 inches from film's edge. So I'm just going to have her lift her arm up, and I'm going to slide the cassette. There we go. There's the carpal bones, 1.5 inches from the edge of the film. Then I will have them at the same level, and I will not have the stair stepping. Now I can fine-tune my collimated field and my centering. Baby shadow, evenly spaced. Baby light over the lead strip, and some collimated field here. This crosshair is coming right down the forearm with the humerus bent, coming off the film at a 90 degrees, and then I want her hand in a true lateral position. I want the distal radius and ulna superimposed. Distal radius and ulna will be superimposed. That's also the criteria when I look at an image on an x-ray. That will determine if I did a good job positioning her lateral. Distal radius and ulna superimposed. The elbow will look like it should be projected with the epicondyles perpendicular, one right on top of the other. It'll look like a round, penny-type shape with the radial tuberosity and profile. Okay? We'll let our patient relax. And again, this was a distal forearm. I put the Carpal bones 1.5 inches from the film's edge. With this particular patient, if you had a shorter arm, they could be a little further from the film's edge. With a longer arm, go with the 1 inch from the film's edge, not closer, or you'll be clipping pertinent anatomy. That was a distal forearm. Okay. Proximal forearm, I'm going to reverse the cassette, proximal forearm, so the ID blocker is towards the carpal bones. I will put the lateral here so the humerus can go off, and the AP over there. Okay. We'll just do this real quick for you. It's the same criteria that we talked about. I'll just recap real quick. Proximal forearm, AP there, no foreign objects on, and I'm going to have the elbow joint 1 inch from film, or excuse me, 1.5 inches from film's edge because of her arm allowing that. Now I'm going to focus mostly on the elbow because it's proximal. I'm going to make sure the epicondyles are parallel. Equal light, little bit of light, the crosshair coming down the shaft of the arm, and a left marker, fingers up, would go towards a corner here. Okay, and I can make the exposure and let her relax. Reverse the lead strip, turn the cassette, have her lean in so the humerus comes down. And I'm looking back here on the elbow. I want to have the clearance. I want the 1.5 inch clearance here. So it looks pretty good. So now I'm going to do my tube. Again, the forearm is bent at a 90 degrees. Elbow joint is 1.5 inches from the film's edge. Equal light on both sides, baby light over the lead strip, little bit of collimation on this edge, and this crosshair coming right down the forearm. And I'm making sure that the shadow of the elbow over here is 1.5 inches from film's edge. Let's see if the camera can focus in on that. I don't know from this angle if it can or not. But the entire elbow shadow is included on this film, and I've got 1.5 inches here. Okay? Look at the wrist. Make sure it's lateral. His distal radius and ulna should be superimposed. Okay? You can relax. I'm not going to demonstrate a right to you on the film, but we are going to talk about where you'd put the AP and where you'd put the lateral. Right? Just hold your right arm out. That would be fine. If it's a proximal injury, ID blocker will go there. AP will be on this side because you want the forearm and the forearm and the humerus bent. You want the humerus coming off the film. Just always think about, in a lateral position, the forearm and the elbow will be bent, and you want the humerus coming off this edge of the film. For a proximal, it would be the same thing, other than the ID blocker is, I'm sorry, I said proximal, didn't I? Distal, the lateral would be on this side, the ID blocker would be towards the elbow, and then the AP would be on this side. Okay? And Dre, can you just hold your arm up in the air? I want to show them this marker. This is the relationship. The x-ray is going to be hung fingers up. So make sure you put your L's and the R's. I want to make sure you see that, how you can read that marker there. Okay? Think of fingers up. And that's your forearm.